So welcome everybody to session 2 of our 4-session digital health and responding to COVID sessions. I think I said sessions a few too many times then, but you get the gist. Before we begin our session, I would like to just acknowledge the traditional custodians of the land on which all of us are meeting from, and where you potentially are watching this on video, and pay respects to elders past, present and emerging. Before we go any further, I would like to just do a quick poll. This is just so we can survey your learning now and also at the end and make sure that we're actually helping. So I'm going to pop that up now. If people wouldn't mind completing that, that would be great. There you go. You should have that up. So just whichever statement best represents how you're feeling right now. Cool, okay. I'm going to show you so you can all see. People are feeling pretty okay about where they're at the moment and just want to know a little bit more. So I reckon we can do that today. I reckon we can help you out with that. The people who are feeling confident will try and inspire you. We might just entertain you. We may not inspire you, but we'll see where we end up. Thank you. And I'm also going to share a PowerPoint so Jane can start with some of the presentation. There you go.
Well done, Naomi. Thank you very much for that. I'm not sure that all of you caught when I said before, but my name's Jane Morton. I'm a colleague of Naomi's, and I guess we work in similar areas, and yeah, so that's why we ended up working together to put these together. So today is, as Naomi mentioned, the second in the series of our 4 webinars. And next week is managing dual diagnosis and experiences of mental distress. And then the 4th week will be identification and risk management relating to family violence, because that raises a whole lot of, I guess, special issues that we don't always come across in other types of presentation. So in today's presentation, we're going to do a few things, and we're going to try and divide it up so that we have, a couple of slides and whatever, and then we'll get you to break off into some small groups, which is amazing that Zoom can do. It automatically puts everybody into rooms, and it times us, which is excellent. So we'll do that, and then the second part of the session, we will again have a few slides just thinking about self-care and what everybody can do, I guess, for themselves while they're trying to manage their clients and manage everybody else in these difficult times. And then we will also have some discussion after that. Okay, so I guess the first part of generic managing risk and harm, and I'm sorry if anyone is online who was online last week, because I'm retouching a little bit on some of this, but it's only a small part of today. We'll be talking what we did last week. A really important thing is to know where your client is when you're talking to them. And it could well be, I mean, if it, not just from the privacy point of view, but if you're having a discussion with them and your client's pretty distressed and is perhaps suicidal or whatever, and the line drops out, and you've got no idea where they were. So it's always useful to have, I suppose, an agreed location when you're talking to them. So make sure you know where they are at the beginning of the conversation before anything else can happen. Also, obtain your client's consent prior to any of the sessions. And look, in most cases, I guess, existing clients who were existing prior to COVID-19 would have signed client consent forms and whatever in the office. New clients that have come on board since COVID started wouldn't necessarily have seen anyone face-to-face to actually sign paperwork. So in most instances, client consent can be given verbally, and again, you would need to check your organisation's guidelines on this. But clearly document that, and you know, that's documenting basically what the client said, what they agreed to, what time, place, all the rest of it. Just in case if something does go wrong, that you have that in writing. And also make sure that you've got any details of emergency contacts or people that you can contact if something goes wrong and you lose contact with the client and they're suicidal. And also make sure that they're accessible when you need them. And look, that means for a lot of us, people can't actually log on remotely to their databases. I know in a lot of AOD agencies it's not so bad, but in hospitals, it's extremely difficult for people to log on, and they have to get special permission, and most of the staff don't have it. So if you are going to be seeing a client or talking to a client over the phone, make sure that you actually have those contacts with you so that you know who to contact and you don't then have to log on and try and find out. Okay. All right, we're just going to talk a little bit about managing risk and harm. Some of this is quite basic, and you know, I mean, I would imagine that you are already doing this with some of your clients. So emphasise the hand washing, prepping their own drugs, make sure they wipe over their own injecting equipment with hand sanitizer or bleach or whatever they've got available. And of course, avoid sharing where possible. That certainly hasn't changed. That was certainly the case prior to COVID-19. Don't go out if sick. So, you know, if they're unwell and have a temperature and a cough and so forth, try and arrange somebody else. Now, I know that's often difficult, particularly, you know, in some of our clients have very chaotic lives, but where possible, arrange someone else to go out. And the next one is an interesting one: stockpile injecting equipment, drugs, and you know, pharmacotherapy and naloxone. And virtually, I suppose, a lot of agencies have put out harm minimisation fact sheets, and I've actually got a slide which has got the links to them all on it, which you can have after this presentation. We will actually be putting the slides up on the VADA website, so you will be able to access them. So you don't need to take notes or anything like that. But in terms of the stockpiling the drugs, I know yesterday in the Herald Sun, there was a big thing of shock, horror, how dare they actually ask people to stockpile drugs? Because I guess intuitively, that doesn't sound like a harm minimisation type of strategy. But the reality is, if someone's stuck at home and they go into withdrawal on their own, then the outcome from that can actually be worse. Other agencies also mention substituting drugs. So if you can't get your heroin, substitute with some benzodiazepines and so forth. Again, not ideal, but given that we're in a situation where the entire situation isn't particularly ideal, sometimes we have to be fairly, I suppose, creative and proactive in the way we do things. And certainly stockpile naloxone, certainly in case of overdoses. Have a contingency plan to avoid withdrawal. Yes, I've pretty much mentioned that anyway with the stockpiling. And also, there have been some changes to the pharmacotherapy prescribing guidelines, and in particular around takeaways and third-party pickups. So if you're unwell, you can actually go and get somebody else to go to the pharmacy and pick up your dose for you. So those changes are actually on the Department of Health and Human Services website, and the link will be available to take you straight to that, so you can advise your clients.
Jane, do you mind if I perhaps jump in here with a couple of other...
Yeah, no, go for it. Go for it.
The other things around harm minimisation, which are potential considerations for you as well, that I don't have answers for, it is more about raising it or posing it as a consideration, is with, I guess, the current access to drugs like heroin and other opioids, particularly where it's really difficult to be transporting drugs across borders and within countries, and also with the introduction of SafeScript, with people perhaps less likely to be able to access certain pharmaceutical opioids. Is this concern around or an awareness of whether people are going to be accessing synthetic opioids and what that might mean in terms of harm reduction, in terms of risks, in terms of poly drug use? What I'm happy to share with you afterwards is we have a pre-recorded session from Turning Point, which was looking at new and emerging drugs, and it does give a really good overview of the impacts of synthetics, and particularly synthetics with polydrug use, and also when, you know, what it's safe to mix with, what it isn't safe to mix with. So that's something to just be aware of as well, given the current situation. The other thing, which is not so much, I mean, I guess it is COVID related, but it's indirectly COVID related, is the increase in money that people will now be receiving in terms of the JobKeeper/Job Seeker payments. With an increase in money could potentially lead to an increase in use. So that may be something that puts people at risk of overdose. So having a structured plan to, talk to people about extra finances. I mean, how are you going to use that? Can you pay off bills? Can you pay off loans? Can you pay off debts? Is there another way that money can be safeguarded to potentially keep people safe? And I guess the flip side of that is, hopefully we won't, but if we do come back to a lower amount of money again in future, what does that mean if it potentially puts people at risk of withdrawal or needing to minimise or reduce their use? And the thing I wanted to raise in terms of minimising harm is if people are needing to go out to purchase drugs, to access drugs, substances, and they're living with family or friends, the risk and the COVID risk to people if they're going outside. So if families and loved ones are concerned about that there are support groups that you can link them in with. So places like Shark and Family Drug Help, Family Drug Support can offer support to family members at this point as well. Thanks. Sorry.
Yeah, that's all right. No, they're all really good points, Naomi. And look, unfortunately, as you say, we don't have a lot of the answers to that at the moment. I think I know discussions at a higher level have been happening about trying to collect some of the data around this sort of stuff, but it is massive, and trying to put that into a usable format to then, if we need to do the same thing in the future, creates its own challenges. But yeah. Okay, these are the resources that I mentioned, and they are literally just a list of websites that have, and fact sheets that have slightly different information on all of them, but they are quite useful, and you can also download them, and if you can virtually send them to your clients, well then, or at least give your clients the links themselves, then they can access them. Okay, effective communication. Communication completely changes, as you would all be well aware, when you are speaking over the phone as opposed to speaking to a person face to face. And I guess, it involves a total way of changing the way we do things when we're communicating with people. So I guess to start with, we need to be both verbally active as well as doing a lot more reflective listening. And I know that almost sounds like a contradiction in terms, but in terms of being verbally active, we need to actually ask the client a lot more about what's going on, because we can't read the visual cues. So, you know, often clients will talk to us and they'll say things, but you can read from their cues that perhaps, oh, they're not really letting on what, you know, the whole story, or there's something else going on here that's distressing them or whatever. Without that, we're not going to know unless we actually specifically ask them. So we actually need to ask them outright about how their feelings and their emotions, you know, in particular circumstances, and what's happening for them at that time. In terms of reflective listening too, yes, we have to listen harder, again, because we're not reading other cues. So that involves often, I suppose, doing a lot of repeating, summarising back to the client what they've told you, asking them if that's correct. It also means, and I guess in the verbally active side as well, it also means asking your clients to do the other way. And that's actually called a teach-back method, where if you explain something to someone and then you actually get them to repeat it back to you. And that, in that way, you can understand that they've actually got it, you know, what you've said. It's a technique that's often been used with cold clients and people who can't speak English very well. And I suppose up until now we haven't had a lot of need to use it in English-speaking clients, but it's also a useful technique. I guess be aware of your voice at the same time. You know, don't rush through something, or, you know, because remember that the client is going to be reading your visual cues in an interview as well, a counselling session. So make sure that you're speaking at a pace. And again, the line mightn't be great. You know, people can't hear as well as they are face to face. So those are all considerations.
Thanks, Jane. I might just stop sharing now, and I had a couple of other points I just wanted to raise around communication, and again, mine are more questions and considerations, which will then give you an opportunity to explore a bit further in small groups, so you can just unpack it and see whether it makes sense for you or what that might mean for your practice. But some of the things around communication, or certainly the things that we've been hearing, is that some clients are more likely to want to share more than normal because of the fact that they're feeling less vulnerable, they're perhaps feeling a little bit safer because they're on the phone, they're not actually in person, they're potentially in a safer space or a less public place. And what that means in terms of being able to respond to those additional disclosures, or whether you have the right referral pathways in place to be able to manage some of that. And also some people who are disclosing less in this space. So it's not one size fits all. There's a lot of different unique kind of individual responses. But for those people who are responding less, you know, I think a couple of the key issues that stand out for me are, you know, the ways in which we're connecting with people, because it's quite difficult to connect with someone just over the phone with no visual, with nothing else, with no, even if there is already an established relationship, to maintain that connection and rapport over this indirect way is quite difficult. And also this idea of trust, this trust and honesty. How do you know what people are telling you is genuine? How do you build trust with people in order for them to feel safe to be able to disclose? And the types of things I kind of wanted to put to you was this idea, you know, trust is both ways, right? Like, it's not just about us learning to trust clients, but clients learning to have that trust in us as well. And just considering the ways that you can actually develop that. You know, what are some things that you can do to ensure that the trust is there, that doesn't require that interpersonal connection? And what stands out to my mind is this idea of being reliable, obviously, of you know, doing what you say you will when you say you will do it, with even more integrity than you would normally. And also taking some kind of action, right? Like, if you build trust, you don't just give trust. It occurs over time. So if it's about taking a bit more of a case management role and, you know, linking people in with services to show that you are reliable, that you do what you say, that you follow through. It might be sending people additional resources via email, or making there's other types of connections to demonstrate your reliability and integrity. And the other idea around connection, you know, how we're connecting with people and the ways in which you would normally connect with people just aren't available to us right now. And as we know, most of our communication is nonverbal. So how do you ensure that you've still got that same sense happening? And I'm trying to read my writing here. I've made some notes, but it's difficult. I'm really, really terrible handwriting. So, I mean, if people are feeling, or you're feeling, that people aren't connected or aren't engaging in the way that you normally expect, then ask, what does connection normally look like for you? What does engagement normally look like for you? What are the things that are valuable for you in a relationship, that make you feel that there's rapport, that make you feel heard, that make you feel validated? Seek the information from them to be able to know what they need from you. And what's interesting when you take that as an option or as a method, is you learn a lot about what's actually important to them. You're not making assumptions about connection. So it might be they can't talk about a time, or they can't articulate what connection actually is to them. And that in and of itself is an important space that you can open up to find out. When have you felt disconnected previously? What has that meant for you? What have you done to resolve that? So it's empowering the client in this relationship as well, because it's not all one way, right? It's not all up to you to make up for the difference of not having an in-person relationship. How do you kind of work with the client to get clear on that? The other thing is around language. So when you have that much more emphasis and presence and focus brought to language, you notice the words that people are using, or the phrasing that people are using, or even some of the terminology around I see, or I hear, or I think. They're all things that you can mirror back to people in the language that you use. They're all things that you can, that builds without the physical mirroring. It's the language mirroring which still develops a sense of connection. And if they're repeating particular words a lot to describe how they're feeling, or to explain their current situation, use those same words back to them. Yeah, that still builds a sense of trust and connection that otherwise, you're not having in that physical sense. But you could also explore the use of those words. Were you aware that you're using this word a lot? Were you aware that the way you're describing this is you're using these types of phrases? And just find out a little bit more about what that means to people. And those things which, we may inadvertently or just subconsciously be making assumptions about when we're in person. It's actually a time now where you can really explore some of that, which, potentially gives rise to better opportunities for connection and better opportunities to build that trust. What I thought might be helpful now is to break people up into small groups, to just have a chat with each other about the types of things that you're doing and trying, and the things that you're finding are working when you are trying to establish that real strong rapport and strong connection with clients in this way. So we'll break up into groups of like 3 or 4, and you have about 5 minutes to just, hopefully that should be enough. Maybe I'll give you a little bit longer, 6 minutes, just to share some of those things, reflection on what, Jane and I have shared, or just reflecting on what you're doing yourselves and what you're finding is working. Does that sound okay to everyone? Yeah, we got nods? Sweet. Okay. And you should get a little invite on your screen to go into a room and just accept it. We'll see you soon. Hi, welcome back everyone. It's the coolest thing watching everyone just come onto the screen. How did you find that? Would anyone like to share perhaps some of the discussion from their group? Don't feel that you have to, but if you'd like to. Is Deborah saying no, or is Deborah saying maybe? Deborah's still on mute. I can't.
Having a great conversation with myself. Yeah, basically from my role about parents not being able to have that physical contact with their children with DHS at the moment is causing a lot of problems for them. And Elaine was talking from her point of view about, counsellors are really sort of taking on a lot more at the moment during care and recovery. Yeah, so it's an intake slowed down, and also the withdrawal and detox centres, because they've slowed right down, is also, you know, a little bit of causing a bit of difficulty. But yeah. So.
Yeah. Well, so thank you for sharing, Deborah. Was there anything that anyone else would like to add to that, or anything that you know, they found helpful from the discussion? Putting their hand up. No, that's okay.
Okay, I think we're going to run out of, I think we need to keep going, Naomi, with it, just from a time point of view. Yeah.
Yeah, sure. I will pop up the PowerPoint again.
Yep. Isn't technology wonderful? Okay, I guess so for the second part of this session, we just wanted to touch on a bit of self-care as well, because it's been so difficult for everybody. Certainly when I was looking at some of the literature around this, the major thing that came out was talking about building people's resilience. And I know that there was a few studies that have actually been done on this, and in fact there was one done with Lifeline in Australia as well, and it came out with the same thing. And basically, so, you know, hardiness was found to buffer or lessen the negative effects of stressful events or adversity. So, and you know, we can have, I suppose, quite a lot of control over what we do to develop our own hardiness. And I guess from our, you know, in our sector, so we would have regular conversations with our colleagues and managers by phone. Obviously, we don't have the situation where we can come out of an interview room with a difficult client and just immediately debrief with everybody around you, which, you know, is obviously extremely valuable. But I think we need to be aware that if that's the case, then yeah, we need to pick up the phone and ring someone, and whether that be another colleague or your manager, and just it doesn't have to be a long conversation, but just that dust it off, debrief type of thing. Access supervision regularly. You know, I know most managers should actually automatically provide this, and they should be perhaps checking in with their staff members on a daily basis over the phone, or even twice daily, just to see how they're going. Not just how their clients are going, but also how they're going and how they're managing at home. But if you're a worker, take the initiative and you know, ask your manager for that sort of follow-up. Practice mindfulness on yourself. So, and I mean, a lot of us have been trained in mindfulness therapies and whatever that we use with our clients, but often we forget to use those same sorts of strategies on ourselves. So be mindful of what's happening to your own thoughts when, you know, you're really stressed by all the stuff that's coming out of this situation. And again, go back to basics. Make sure you're looking after yourself. I think a lot of people are in this space are really, really worried about their clients, you know, because they know how isolated and not coping their clients are. And I think it's very, very easy to forget about yourselves in amongst this. So make sure you're eating a good diet. Make sure you're exercising. Make sure you get time for yourself. I know that's difficult if you're in an apartment with somebody, but go for a walk. You know, just to get half an hour by yourself. Make sure you've got proper boundaries in place, so you have a designated workspace at home if you can. And, you know, I know it's often impossible to avoid interruptions, but, you know, try and make that if possible. Set your daily work hours. And I know at home it's really, really easy. And look, I can speak for myself on this. I normally work 3 days a week at VADA. That is currently being stretched over 5. Because of just the way things have happened being online. So I've actually found I've all of a sudden got all these hours of till time up. that's just because I'm probably not practicing what I preach here. So set your daily work hours, keep to your schedule, take breaks, make sure you have a lunch break, and clock off at the end of the day. So, right, I've finished, turn the computer off, go and do what you would otherwise do, like, you know, cooking the dinner or whatever the case may be. Talk to others in your household. Yeah, so that's some basic stuff, but we also thought then, I think Naomi wants to add in a few things as well, and then we can have a little bit more discussion.
Cool, thanks, Jane. And yeah, the boundaries, particularly when, and we touched on this last week, particularly when the personal and the professional are so merged at this point in time. It's really difficult to sustain boundaries when, you know, your work life is in your home life, is in your home space. There were a few other things I just wanted to raise though as well, just again as points to consider, is firstly, I mean, we are working really differently now, and I think even just being able to recognise the wins in what we're doing. So how we kind of redefine success, how we redefine what our satisfaction in our work looks like, what are the, you know, how we understand the different ways that we're having an impact. And I think also that even though this is territory we've probably all been in for a really long time, what we're doing now is new. So it's having, I guess, that patience with learning new ways of being and feeling confident and feeling successful, which may not come naturally right now, but it's being conscious of that and it's bringing that into your practice. So if you are having wins with clients, you know, it may look different, but acknowledge it that it's still a win. I think Jane touched on it definitely, that idea of collegial support. It's really different now when you don't just have an office member that you can just, I mean, your dog or your cat might be copying a few of your debriefs, but, you know, it's difficult to then call up someone on the phone or to find a time for a manager or to do it later or to do it at the end of the day when you need to just offload it at that point in time. And we need this kind of support, we need this kind of collegial support, and we need this ability to, I guess, transition from one client to another, to just let go of the things that maybe have stressed us or have built up. We need to do it now more than ever. I mean, we're required to be that much more present while we're on the phone with people. We're required to be that much more focused. And even meetings like this, where we're not used to seeing this many faces in such a small space. We're not used to seeing this many backgrounds, this many people moving. Our brain is in constant overwhelm trying to take in all this new information. So, you know, you may find that you're actually more exhausted than usual. You may find you're more mentally tired than usual. And that's normal, right? That's actually okay. So it's how do we start to address some of those things, which may be not in our usual self-care practice. It's like we're constantly on high alert. Yeah, because things are constantly new. It's constantly different. We're hyper focused. And if we don't find ways to kind of calm and settle, then we'll find ourselves that we're becoming deregulated as well. Yeah, that emotion. You know, if you're feeling stressed or anxious or overwhelmed, that's the lens through which you see the world, right? That's the lens through which you experience all of your interactions. That's how you understand things. So if we're not able to kind of manage what's happening for ourselves, that's going to be how we see our clients and the lens through which we experience them. And our family, you know, not just for ourselves, our family members, our friends, you know, anyone that we come into contact with. So now more than ever, you know, that critical self-reflection is super important. And this issue of co-regulation, like normally you would know this, right? If you're able to maintain that sense of calm, that sense of stillness, that sense of presence when you're with your clients, that naturally becomes something, a space that they take up as well. You know, you often find if you spend the time and you listen to someone and you allow them to get their frustration out, that your calmness actually creates a sense of calm for them. So if you're not in a space where you're really present, not only are you going to be, is that going to be drifting across into other relationships, but it's also this sense that what other people are experiencing can impact on you. So if you're constantly feeling this sense of chaos, constantly experiencing this sense of uncertainty and not knowing and not feeling safe or stable, if you don't have your own boundaries really strong, and if you don't have your own sense of regulation and being able to process what's happening for you, then you're going to pick all this up from other people as well. I mean, and that leads to burnout, which leads to shutdown. Yeah, that's when we numb, that's when we disconnect, that's when we just go, I can't be in this space anymore. And what happens when we go there is we get stuck in our heads. Yeah, we get stuck in our heads and we're actually disconnected. We're kind of from here down, we're disconnected. So what I'd really recommend for people to do is to start to do some practices that bring you back into your body. that bring you back into that sense of connection, that bring you back into the wholeness of who you are and what you're experiencing. Because your central nervous system is working overtime right now. Yeah. So it's not only how do we do that usual critical reflection, but how do we also calm and center through our physical body as well as our mental body. And some of the things that I would suggest, some of these are kind of what we call grounding practices. You're probably familiar with them. You've probably done these types of things with your clients, but I would highly, highly recommend bringing this into your own practice as well. One of those things is to just touch base with all your senses. Yeah. So what are you seeing? So even if you do have a difficult client, or you're feeling a bit fractured, or just take note of the things that are in your room, in your house, wherever you are, and not just as a visual kind of quick once over, but genuinely connect with them. Orient yourself to the environment that you're in. So you're feeling that you're in that body, you're being able to see things. Touch. Yeah. And particularly, this is going to sound a bit weird, but trust me on it. Touch the big muscle groups in your body, right? Touch your arms, touch your thighs, feel the fact that you have a body, right? And that's because you can't touch anybody else at this point in time, but it's also just bringing you back to that point of view. This is an embodied experience that you're having. Yeah. Bring yourself back to that point. What are you hearing? Close your eyes. What are you hearing? You know, grab something from the fridge. What are you tasting? Although that may be not such a good idea. I keep saying, instead of flattening the curve, I feel like I'm fattening the curve over here because I'm constantly eating, but, taste something. Be mindful about tasting. Yeah. Smell. What are you able to smell? Bring your experiences back into your body. Nature is also a really amazing one as well. Like, I think because a lot of the work that you're doing currently is over the phone, consider whether it's safe to go for a walk while you're talking with a client. Yeah. If there's no one else around and you're still maintaining confidentiality, is that something that you're able to do? Yeah. So you're actually out in nature. So you're moving. So you're getting perspective. Imagine grounding yourself. Yeah. Imagine roots coming out the bottom of your feet into the soil. Feel grounded, feel stable, feel centered. All of that is going to help you to not be as easily swayed and to not be as easily kind of coerced into all these other emotions that are happening for us. And this really beautiful, well, I think it's really beautiful. You might not, but I'm going to share it with you anyway. I like the idea of imagery in terms of understanding things that are happening to us as well. And one thing that's kind of come to mind is this sense of the fact it's like being in a snow globe, right? And everything's been shaken up. We've gone into complete chaos, complete disarray. Everything's not how it used to be. But over time, all those little those pieces of snow all settle. Yeah. But if you can imagine that kind of like calming your central nervous system. Yeah. Slow it down, allow it to settle, allow it to calm. And from that point, you're then going to be in a much better space to not only manage what's happening for you and to process what's happening for you, but to also be able to maintain that sense of calm and that sense of stillness and stability for the people that you're engaging with. Not just your clients, but your family, your friends. I'm sure, you're all people, otherwise you wouldn't be doing this work. So I'm sure that, you offer a lot of support to other people in your life as well. So, make sure you're in that space to be able to manage you first and then manage others. So what we thought is we might pop you back into little small groups again to just reflect on something that we've discussed in terms of self-care, to share with each other, what really resonated, what didn't, what you want to try, what you are currently doing, just to get a bit of that collegial support and a bit of an idea of what's working for others as well. So I'll pop you into small groups and then we'll come back and see how you all went with that. Is that okay for people? Yeah, cool. All right. Let's do that. And you've got, is 4 minutes, do you reckon 4 minutes will be enough?
Yeah.
Yep, cool. Cool. So welcome back, everybody. How did people find that? Would anyone like to share anything that resonated or share anything that they learned from their group that they might want to apply?
I think for me, it was that everybody's experience is slightly different and everybody's challenges is slightly different. Everybody's home circumstance is slightly different. Children, pets, the environment that they suddenly find themselves working in might be one room that they can set aside, or a room that they're having to use to live in as well. And it's very difficult to put boundaries in place.
Yeah.
And I think it's different for everyone. So having some of the generic self-care tools that you just gave, I think there's some of those that there's something in there for everyone, not maybe all of them, but we can all do some of those things.
Absolutely, Elaine. Absolutely, because it is such a personal, and it even shifts and changes over time. So, you know, what might work for you in terms of self-care at one point might be something, you know, it doesn't work at another time. So it's constantly checking in to work to make sure that you're meeting your needs.
Yeah.
Yeah. Thank you. Is anyone else keen to share? You don't have to, don't feel you have to. But if anyone else is keen to share. Yeah, cool.
I just thought as a quick thing that I thought was useful was we were talking about the benefit of looking out at a distance. I like that phrase. I hadn't thought of it like that, but you spend a lot of time with your computer. So we talked about the importance of windows and walks. That's
it. Amazing. And when you speak about that, I just think perspective. So like this idea of visioning something outside or further than where we currently are as well. But thank you.
I think too that it is a finite situation. I mean, okay, we don't know exactly how long it's going to go on for, but we do know that at some point we are going to be able to go back to the office and see people face to face again in the future. So I know that's one thing that's helped me is think, okay, it might be another few weeks or a couple of months, but you know, we will get through this type of thing.
Not forever. Yeah. Whereas I'm I kind of like working from home, so I'm happy to say.
One thing that I've noticed is that all this is just such a great leveler as far as when you're talking to the clients and they're going, oh, you know, and they're freaking out about it. It's like, well, we're all in this, you know, everyone. And so it kind of brings everyone down to that worker and client and everybody to that level of we're all going through this together.
Yeah.
You know, we're all experiencing something for the first time. And I just think that kind of helps a little bit.
Absolutely. I've heard it called the great equalizer. And indeed it has been. Thanks so much, everybody. What I would love to do now before people leave is just to do another quick poll so we can again just get a sense of whether this was helpful, what you found helpful, and we can tweak it as we move forward. Next week, we have Gary Croton joining us, who is Mr. Dual Diagnosis. So he'll really be giving us some great input and insight into helping to manage some of the mental health presentations that might be happening now. And then in the final week, we also have some other presenters joining us as well to talk about the family violence implications as well. So that'll be the next things that we've got coming up. But if you don't mind spending just a moment or two to complete these two polls, that would be amazing. And there's two questions. One that is looking at just how you felt the session went and whether it was helpful, and the second one is what you enjoyed the most. There might be one or two more people. Yep. Beautiful. Okay, I'll just share these results with you so you can see what other people are saying and how people are feeling. So again, similar to my comments last week, there's clearly a lot that you're doing really well, and there's clearly a lot of practice wisdom already. So it's, you know, it's feeling confident in what you're doing, you know, intuitively and instinctively. But always really great to have that reinforced. And clearly people are really valuing the opportunity to connect with others and to share with others. So we'll keep bringing the interactive element, the small group element into these sessions as well. So you do get a chance to connect And please do feel free to contact Jane or myself if you have any other comments that you want to make, or any other questions, or even any other suggestions about topics or activities or things that you feel might be helpful to support you through this time as well. So we're always open to other ways that we can provide support to the sector. So otherwise, have a great week, and we'll hopefully see most of you again next Wednesday.
Thank you all very much.
Ciao.
Bye.